Greetings and welcome to today's webinar. My name is Elena Kennedy and I'm the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans. We will be joined by our wonderful two panelists shortly, but before we dive into the presentation, I'd like to take a moment to walk through the logistics so you understand the platform that we utilize here at IAMHP. IAMHP utilizes the GoToWebinar platform. As such, a GoToWebinar control panel should have popped up on the right-hand side of your computer screen. This is how you will interact with today's presentation. Hopefully at this point, all of you should be able to hear and see me at this time. Should you have any audio issues or connection issues though, you can submit those via the questions tab. The questions tab is a wonderful way for you to go through and ask questions about both the logistics as well as the presentation itself. I'm coming up as IAMHP admin, as you can see, or IAMHP organizer, depending on the version you might have. All questions will be directed to me, and I'll answer a few of those as we move along. You can also direct those via the chat function. Once again, I'm coming up as IAMHP admin or IAMHP organizer. You can ask those questions to me directly, as well as chat with other attendees here today. I want to acknowledge, though, that due to the version of GoToWebinar you might have, or due to firewall protections at your organization, you might not be able to access the chat function. We apologize for that inconvenience and appreciate your understanding. One final note before we dive in further into our presentation today is you can move between your phone audio or computer audio. So should you lose phone audio or computer audio at any point, you can change between those two different platforms. Please note that if you want to utilize your computer audio, you will have to give access to the platform. Now, with the logistics out of the way, I am really excited to set up why we are here today and why you are all taking an important hour out of your day to learn more about maternal health. As noted, my name is Elena Kennedy, and I'm the Chief Operating Officer at the Illinois Association of Medicaid Health Plans, which I've been referring to and will continue to refer to as IAMHP. We here at IAMHP and our member health plans believe in finding new and effective solutions that respond to the complex health needs of our members, especially pregnant mothers, new moms, and their babies. It's really no exaggeration to say that the health of our nation and community here in Illinois' future depends not just on the quality they receive through the Medicaid program in general, but especially for the quality of care around our maternal and infant health. As Medicaid covers nearly half of the births here in Illinois and across the country, actually, we have a important vested interest in having conversations about it and addressing that across the state. So that is why we are having a conversation and celebrating maternal health here and really focusing and talking about maternal health here at IAMHP in the month of July. And we cannot talk about maternal health without our wonderful panelists today. I'm joined by Leader Greenwood, who is a Democrat member of the Illinois House of Representatives, who have represented her district since January of 2017. Prior to her election to the Illinois House of Reps, she served as a member of the East St. Louis City Council and Director of Human Resources for East St. Louis School District 189. She has a Bachelor of Arts from Michigan State University and a Master's of Public Administration from Southern Illinois University of Edwardsville. Welcome, Leader. We're happy to have you today.
Thank you.
With that, I'm also joined by Samantha Olds-Fry. Samantha has over a decade of experience in healthcare and appropriations policy as Executive Director and Chief Executive Officer here at IAMHP. She's responsible for coordinating Quality and Operations Committee and working closely with state agency administrators and lawmakers such as Leader Greenwood to formulate and implement policy that positively impacts members. Prior to joining the association, she was a research and appropriations analyst for the Illinois House of Representatives, and she has earned her bachelor's degree in economics from St. Louis University and her master's degree in public policy and administration from Northwestern University. Without further ado, welcome, ladies.
Thank you, Elena, for that very warm introduction. And thank you, Leader Greenwood, for joining us today. I think, Elena, you've already sort of provided a brief overview of why we're here today and why we're going to talk about maternal health. but I'll dive into it a little further for just a minute, and then we'll really open up the dialogue with Leader Greenwood and the work that she's done in the Illinois House to really strengthen the Medicaid program for moms and babies across our great state. And so, as you've already mentioned, Illinois Medicaid covers 50% of the births in the state of Illinois. And so what that really means is that 1 out of every 2 babies is born and supported by the Medicaid program. And so how we structure our policy for birth outcomes and birth and reimbursement for labor and delivery, how we support pregnant women, but also women in the postnatal period and infants, is not only going to impact those families directly enrolled in the Medicaid program, but really the entire community in the entire state, because Medicaid is such a large payer for maternal health. And when we talk about maternal health, we often think of sort of those 9 months that a woman is pregnant. But what we've seen over and over again is that that is too short of a period to discuss maternal health and healthcare outcomes. You need to really look at time prior to pregnancy, and critically, really that year after pregnancy and that perinatal or postnatal period. So that is absolutely critical, and that's what we're going to be talking about today, not just during the pregnancy, which is an absolutely critical time, but also that postnatal period, and how are we supporting women, how are we supporting families, and what does that mean, and what has Illinois already done, and the great work that Leader Greenwood has already done, and then what's sort of on the horizon, and what are we going to tackle going forward. And I think, you know, let's bring you right in, Representative Greenwood. You've been a legislative leader, and now you're in leadership, you know, in the healthcare and specifically maternal healthcare space for a while now. Can you talk a little bit about what motivated you to improve maternal health care in Illinois, to sort of focus on some of this area, and you know, what's kept you in this space?
Thank you. And thank you so much for inviting me this morning to be a part of this panel. What led me to the maternal healthcare space is I had the opportunity to participate in subject matter hearings on Black maternal health and infant mortality that Representative Leader Flowers, Mary Flowers, held in the 101st General Assembly, and I was simply blown away. To hear the stories from women from all walks of life, poor, wealthy, middle class, if they were African American or a woman of color, it was a story that was about death and loss of their baby or the mother. And in some cases, we lost the mother and the baby. So it was just eye-opening to hear those stories from families about their loss. When I think about my own birth story and the conversations that I had with my doctor, who was a male doctor, he was a white male, and informing him at that time I was about 6 months pregnant of a limp that I had developed. So I was walking with a limp, and he just kind of told me that was a part of pregnancy. And so a couple of days after I had my son, I was rushed back to the hospital. And it turns out I had developed a deep vein thrombosis, which the doctors in the ER said was probably developed while or during my pregnancy early on. And so for me, it's about the many Black women who have been unheard for years and years. And it's about the dehumanization of individuals also in the healthcare system that has kind of brought me to this space and wanting me to be more involved in giving voice to those who are the voiceless. And so what should be one of the most beautiful moments in our life have for some turned into just a deep loss and sadness around this state. So for me, it's about so many things, but as policymakers, we should be about ensuring that in our state, in Illinois, that it's the state that values the lives of all women, in particular pregnant Black and brown women. And we must continue to push for the implementation and follow through on legislation that has already been passed and put into law to make improvements in this area to address equity and access and the availability of health care. So I think that's our charge, to make sure that the legislation that we pass is fully implemented and dealt with the urgency that we need to address this crisis.
And you laid out so much there, Leader Greenwood. And first and foremost, I'm so glad that your outcome with your deep vein thrombosis, was caught, was addressed. But obviously that's something that could have had a very different outcome. And your concern should not have been dismissed. And I think that's exactly what we see, time and time again through these heart-wrenching stories from Black women, from women of color, where their experience, their symptoms, that their outcomes are just dismissed, and they are not taken seriously. And regardless of income, I'm so glad you pointed that out, because we often, I think it's previously, maybe 5 years ago or something, it was dismissed as, oh, it's really an income issue, it's not a race issue. And that's not what we see at all. I mean, if Beyonce and Serena Williams can have heartbreaking, heart-wrenching stories like this, it is not an income issue. It is a race issue, unfortunately, an implicit bias within the healthcare system. And we need to just name it and address it through public policy and through conversations like this one. And I think, to sort of put a finer point on what you've highlighted there, is we have these tragic stories of death and of where we lose the child or we lose the mother. But that's really just the tip of the iceberg. And there's really underneath that tons of cases, about 70-1, of outcomes that are far from expected or ideal, where there is harm, where there is pain and trauma, that is not always necessarily being captured. So when we talk about maternal mortality, it's the worst case scenario, but underneath that is a very large iceberg of tons of poor outcomes and trauma, and exactly like what you've said, sort of robbing these women of the most treasured, beautiful experience that they've spent 9 months looking forward to. And it's not only impacting them in that moment, it's impacting them forever, and also their trust in the healthcare system. And are they going to trust doctors? Are they going to trust hospitals? Are they going to turn to them for preventative care? And I think, unfortunately, how we're treating pregnant women is going to impact how their families see healthcare as well. And it's really something we need to address holistically and through public policy. And you've done some of that already. And what I love that you highlight as well is that it's not enough to just pass the law. Right. You've got to make sure and follow up and make sure that it's being implemented, in a manner that's achieving the outcomes that you all wanted. And then if it's not, what's next? What do you have to do next? And so to that end, you've been very busy over the past few years, really strengthening the Medicaid program with regards to maternal health care and access. And I want to make sure that we give you the opportunity to sort of outline some of your legislative highlights and, in your mind, the biggest success stories. And then we'll dive in a little bit further about how you sort of identified those items and where you've seen implementation so far.
Okay, thank you. I just want to comment a little bit about the previous question too, in that it wasn't really for me until I experienced those subject matter hearings that I think that happened to me during my own pregnancy experience. And so I think so many women, and Black women in particular, have just grown accustomed to not being heard, that we didn't even know, I didn't even know that what was going on, what I was experiencing was a form of dismissal and racism, actually, and not recognizing what I was going through. And so I think we need to continue to advocate and raise our voices about what's going on within our healthcare system. And so to get into this question now, again, in following the lead of Representative Flowers and sounding an alarm on this issue and being a chief co-sponsor for many of the legislation pieces that she brought forward in the 101st. It was a complete package that addressed so many issues, environmental issues, trauma issues, before pregnancy, after pregnancy issues. And so we have to continue to, again, enforce and implement and hold the departments and our, our governor to addressing this issue of maternal health and mortality. But to be able to champion for doula services, to be covered by Medicaid, to extend the time for home visits for new mothers, to carry legislation to create policy for implicit bias training for hospital staff, to work with Representative Camille Lilly and the Joint Black Caucus on the Legislative Black Caucus agenda to end systemic racism. And we had our healthcare pillar to pass that legislation and have language included in that. To pass Senate Bill 967 and to work with Senator Castro on addressing maternal death. And it passed unanimously out of both chambers. So to be able to chair the Healthcare Availability and Access Committee, I'm honored to follow Representative Flowers in chairing this important committee to highlight the issues of our constituents. So success stories for me, Samantha, are about hearing from my constituents, and they tell me how what I've been able to advocate for or implement or pass as legislation has impacted their lives, have saved their lives or uplifted their life in some kind of way. So those are the success stories that I look for.
Right. And I'm so glad that you pointed out that when you were experiencing, the implicit bias within the healthcare system, the racism, the dismissal, you didn't recognize it. And that makes sense also, like you're pregnant, you're trying to go through everything. And the importance of advocacy work and telling these stories and talking about this, because the idea probably is that there are probably pregnant women out there right now who are experiencing, dismissal, or who might have, a sore leg and have told it and been told by a doctor, oh, it's fine. It's just, pregnancy comes with aches and pains. And
yes.
Yeah. And, I'm in my third trimester. It's absolutely true. Lots of aches and pains, but limps and, there's discomfort and there's, outside of regular discomfort. And that's where you should trust your medical professionals to look into things for you, to advocate for you, and to figure out what's going on so they can give you the treatment that's appropriate and necessary. And I also think it's always so hard, at least for me, and I think for women in general, and I can only imagine it's probably compounded for women of color, to even begin to raise some of those concerns because you feel like you're complaining. And so you sort of get to the point where you're like, I'm going to raise this, and then, oh, it's fine, it's normal, and you just drop it. And I think that's a very normal thing. And what we're finding out more and more, especially for women of color, is you have to push and advocate for yourself, or have a doula, which will now be covered by Medicaid, to advocate for you and help you navigate that system. And what we've really seen in other states that have had doula coverage is that it closes sort of that disparity gap, and it improves outcomes for especially women of color significantly. And so I think it's a huge accomplishment that you guys, with, with Leader Flowers, with Representative Lilly, I mean, just with such a really amazing group of women and advocates, and we're able to strengthen the Medicaid program in such meaningful ways to address the maternal health outcomes and really to address inequity. Because what we've seen, so here at IAMHP, we pulled together a few years ago all of our chief medical officers, which by the way are all women, at all of the Medicaid health plans, and started discussing maternal health. And in our research of other states and of studies, we found over and over again that clinical interventions, like just, clinical best practices, taking things that a really well-ranked hospital does and translate, and teaching others how to do that, that improved outcomes for white women. But it didn't necessarily improve outcomes for Black women. And in order to improve outcomes for Black women, you had to be really purposeful about inequities and disparities. And you had to address things like implicit bias. And you had to require like implicit bias training, which is why, the Medicaid health plans were very, we're strong champions of the implicit bias training for medical professionals. Doula coverage had such a significant impact because it was that advocacy component that somebody else, when a woman is so vulnerable, I mean, in labor, you are not like, you are amazing, doing amazing things, but you need somebody to help advocate if your concerns are regularly being dismissed, because I think you're just sort of, especially if you're a first-time mom, you don't know, and you're trusting that the nurses and the doctors do. And so a doula to be there to push with who has experience, who knows how like what's in the normal range and what is not normal, and can advocate for you.
Yes, and to that point, when I was working my bill, when it was a separate bill, and I knew a little about doulas. I wasn't that familiar, but in working and getting support, I found out so many people had used a doula. And they were really my white colleagues, and even in talking to some of my Republican colleagues, the males, they had used a doula during their wife's pregnancy. And so it was a thing that needed to be able to create access and opportunity for all people. So I thought that was just very important for us to implement that piece of legislation so everyone would have the access or availability to be able to access those doulas.
And I think that's so critical because there are so many things in the healthcare system where they're accessible to people with means, to people who have a higher income, who can pay out, because often doulas aren't covered by insurance. And so they can pay out of pocket an extra $1,000 or $2,000. Somebody on Medicaid cannot pay that. I mean, that is a lot of money, especially when you're expecting a new baby and, childcare costs and everything else. And and healthcare costs in general. And so the fact that Medicaid and that half of the women that give birth every year are in Illinois are going to have access to a doula and doula coverage is amazing. And not only is that going to impact, I really hope that we will see an improvement in outcomes and closing that gap of disparity and equity, but it's going to actually increase access to doulas for everyone because we're reimbursing this. We're reimbursing for this care. That means that doulas are going to be able to open up small practices or grow their practices, train new people. And so there'll be more doulas that'll be more accessible for all of us. And so by strengthening that healthcare safety net, we're really strengthening the entire program, and the entire healthcare industry. And then there's more word of mouth as well, right? Like, so, somebody maybe on Medicaid, they had access to a doula, they loved it, they loved their experience, they're talking to their sister or their aunt or whomever, and they oh, I worked with this doula, I loved her, I loved the experience, she was a lifesaver, And now other people are talking about doulas and seeking out that advocacy and that critical assistance in really their most vulnerable time. And so I think, I don't think you can underscore enough how big of a deal it is that you were able to, you champion this, and you championed this for a few years, right? I mean, it was a standalone bill, and then you got it, it was fine, it was rolled into the Black Caucus pillar in January, but you'd been working on it before
Right.
that as well.
Yeah. And so in speaking, everyone was in support of the bill because they had either access to it or they wanted to help improve the statistics that we have within our state to help stop senseless, because really these are preventative deaths that are happening when we talk about maternal mortality. And
Right.
so, yeah, I'm very happy that it was included into our Black Caucus pillar.
And the same on implicit bias. You had also had a standalone bill in 2020. Obviously, in 2020, lots of items you didn't see, didn't get to the finish line for the pandemic. I mean, obvious reasons. It was a very different session. And so you came back and continued to advocate for that and got it across the finish line in the Black Caucus pillar. And you and now Speaker Welch had similar legislation and focusing on the same thing about how do we address disparity and inequities. And again, with the implicit bias training piece, it's not just for Medicaid moms, it's
Right.
all healthcare professionals. And so we often talk about it in the maternal health care space because that's where I think there's been so much focus, and the deaths, as you said, they're absolutely preventable. It's very clear that they should have been avoided, and that unfortunately implicit bias and racism and substandard medical care caused them. But it will impact the entire family. It'll impact non-pregnant women. It'll impact dads, because it will be that hospital staff, those doctors, those PAs, those nurses are getting that implicit bias training. And so maybe there will be another, there'll be dads that doctors think, oh, I should take another look at this. Like I should do a further screening, or not dismiss this individual. And I think lives will be saved not only in the maternal health care space, which is critical, but really across our state for a myriad of healthcare reasons.
Yes, and I'm happy you brought that up about just our overall healthcare system in this state, and what the things that we need to do to be vigilant about creating quality healthcare for all Illinoisans. And you mentioned a pandemic, but it just revealed and opened the eyes of so much. But I like to tell people that even before I came to the General Assembly, it was members of the Legislative Black Caucus who have been talking about these issues for a number of years to try to bring attention to what was going on in terms of equity and access. And so I'm going to keep saying it, we have a serious healthcare crisis in dealing with this maternal mortality issue, and just a overall healthcare crisis in making sure that rural and urban areas are afforded the same quality healthcare that we all do, regardless of your income or color or what the circumstance may be. We need to start to ensure that all of Illinoisans have access to quality health care.
Right. I could not agree more. And I think you really hit the nail on the head that the pandemic made it impossible for people to ignore, but it was there. I mean, if you ever looked at the data, and as the Black Caucus legislators highlighted it over and over again, there have been healthcare inequities and healthcare disparities based off of race, not off of income, not off of locality, not off of hospital or doctor you go to, but race, for decades and decades. And that erodes trust in the healthcare system. It compounds negative outcomes for a myriad of reasons, and it needs to be addressed. And I do hope, obviously the pandemic, and the outcomes and the lives lost and the families torn apart, beyond heartbreaking. But it did force, I hope, a discussion on disparities and race and the role that it plays in healthcare and the healthcare that people receive, and what we have to do as a community to improve the healthcare delivery system, because it's our neighbors and our family members and our leaders that are being impacted by this, and it's real people who are experiencing these healthcare disparities and this racism within the healthcare system, where they should be there to, that healthcare system is meant to catch you in the most vulnerable times of your life, and it's failing people. And so we need to collectively, in whatever our advocacy role, or for your case in leadership, legislative leadership, hold the system to account and figure out how do we improve it, because these are people's lives, and it's not just that one instance. It compounds over and over again. If you have a bad experience with a doctor, you're probably not going back, and that may delay preventative screenings. It may delay your prenatal visits, and you're more likely then to have an adverse outcome.
And that's why conversations, this dialogue, is so important to continue, because we have to continue to highlight and talk about these issues if we want to end all of the outcomes that we have so far. So if we want to improve our healthcare outcomes, we have to continue to have conversations amongst policy leaders, advocates, administrative personnel, to make sure that we're addressing these issues and staying on top of it. Because it's one thing to just use these issues as talking points, but it's another thing to continue to enforce and realize and understand, like you said, the lives that are being impacted across our state.
Right. It's public policy feels big and sometimes dry, and it's, words on a long bill or numbers on a spreadsheet, but at the end of the day, it's families, living right next door. It's our own families. It's, people across the street, and it's our entire community and their real lives that are impacted by the things that you guys are all successful at getting done, and then the things that, aren't done, or sort of that continue to be part of the conversation. And I think to that end, leader, what I'm always interested in, and so you've been in this space for quite a while, you've had huge successes and accomplishment, and I'm sure and you've learned from wonderful leaders like Leader Flowers and Representative Lilly. What are some of the lessons that you've learned with regards to the process, the impact of public policy, and then also maybe some of the more sort of surprising things around maternal health care that maybe you didn't fully appreciate until some of these subject matter hearings, or didn't realize until more recently?
Well, another thing, during those subject matter hearings, we heard from doctors that were from Cuba, and we heard about their healthcare system and the things that they're doing over there. Is just, they're doing amazing work in terms of their maternal health and mortality and overall healthcare system. And so what I learned from that is that we have to continue to be listeners, and be open to improvement and how we address these healthcare issues that we have in our state. And so what I've learned is the importance of listening, the importance of building relationships, the work that we do as legislators. It can't be done without the input of our constituents and without the work of advocates, the relationships with my colleagues. All of these things have created a positive experience for me in developing policy. And so my grandfather used to tell me when I was growing up that you have 2 ears and 1 mouth. So I should be listening twice as much as I'm talking. And so I've learned that, and I've learned that it's really helped me to understand this process of how policies are developed, how we see them through to the end, and the implementation of those policies.
I love all of that because I do think, when we talk about, especially maternal health, we're lowly ranked, from a state, but also as a country. And so what that means is others are doing it better, and that some of them have figured out a way how. And so let's listen, let's learn. We don't have to do this alone. We can figure out what's working elsewhere, and how do we bring that here, and how do we bring that in a way that we adapt to the healthcare system that we have, or sort of the uniqueness that is Illinois, or that is, the United States healthcare system. And you guys have done a lot of that. I think, like, when you reference Cuba, and then we see in other states, and we definitely hear this from our care coordinators as well, is that, and back to doulas, is that a lot of what our moms need, our pregnant women need, or women in the postnatal period, it's often not clinical. It's social determinants of health, it's support, it's advocacy, in getting sort of that attention of the clinical system, but it's not another doctor, or it's that how, and that is an interesting sort of addition, because obviously the first piece is some of those interventions are much lower cost, so they're more sustainable, and you can provide access to more people. But it also sometimes, I think, we just assume it's like, oh, we just need more doctors, we need more hospitals, and some of that is true. I mean, some of it's an access issue in certain areas, it's absolutely true, but some of it is we need to navigate the resources that we have in a way that's more equitable. Or that we, for the Healthcare Transformation Committee, IAMHP did some work last year where we started to analyze outcomes based off of proximity to PCPs, to doctors and to specialists. And we sort of went in assuming that the closer you are to PCPs and specialists, the higher your outcomes are. I mean, that was just sort of our assumption. And what we found was that wasn't necessarily the case, that having a doctor down the street alone, that does not have a correlation to your outcomes. But if you look at certain social determinants of health, access to healthy foods, access to safe housing, access to transportation, that absolutely correlates to, cancer screening rates and vaccination rates and all of these other things. And it was sort of eye-opening and critical for, as we talk about how we continue to improve the healthcare system, is sometimes we have to look at outside of the traditional healthcare system.
Absolutely. And so I represent the 114th district. And within that, so I have a safety net hospital, which is Touche, and which is located in the new Cahokia Heights. And so what they're doing, they did receive some transformation dollars, and they're looking to address numerous issues like you just highlighted. And one of the programs that they have that I'm especially excited about is the sweet potato patch. They do the prepared meals for the pregnant mothers, and in making sure that they have healthy and balanced meals. And so those are just some of the things they're going to contract with specialists and ensure that these things are taking place right here in our community to make sure that, again, we have quality health care that is right here. Another thing is just about getting the word out to the constituents or to the community members that it is there. Those services are there and available for them to be able to access. He's also partnered with like the Bi-State, which is our public transportation entity, in making sure that we have a route that can take people directly to Touche Hospital. And so it's a food desert, it's about education deserts, it's about healthcare deserts. And some of these communities, I know many of the ones that I represent, just need that support and the resources to continue to lift them up and to ensure that you have equitable education, healthcare, food, transportation. It's just so many issues, but hopefully we can begin to, again, work together to continue to lift up all of Illinoisans, not just certain segments and populations.
Absolutely. I'm so glad. So for our attendees that don't know, Sweet Potato Patch is this amazing BEP certified organization. Our Medicaid health plans work with Sweet Potato Patch as well. They're doing actually some similar programs and some with FQHCs. And I think one with Southern Illinois Health Foundation as well, where there are these prepared meals. There's a menu. Moms get to pick what they want. I mean, they get to pick off the menu, and they're dropped off weekly. They're fresh, they're organic, they're healthy, balanced. And the idea is, it's not as though these women don't want to eat healthy food. It's not like they don't know what healthy food is. It's that it's cost, it's convenience, it's time. And so the idea being, we'll support and provide this food with this BEP certified organization, and make the lives a little easier for these moms, and improve outcomes. And so I love that is part of Touche's transformation project, that sort of the recognition of that social determinant of health need around healthy foods, and that we're sort of, further strengthening and expanding access to these programs that, if you're at this FQHC, the health plan supporting here or the health plan supporting there, but it really, broader impacting the whole community. And like you said, just making sure that moms know this is a resource available to you.
Yes. And I had the opportunity to do a taste test with some of the moms that were part of the pilot program. And it was just an amazing experience. Some have, other kids. Some were first-time moms. And so I'm looking forward to looking at that data and following that and how it improves the lives of those outcomes.
Right. And there's flexibility. I mean, I think like in terms of the days that it can be delivered, and it's just really an amazing organization doing amazing work. And I do anticipate we'll see some really positive outcomes. The other thing we saw already from the pilot, Meridian's doing the pilot Meridian Health, is that the moms who are part of Sweet Potato Patch and part of this program are more engaged with their care coordinator, with their FQHC, with their doctor, which isn't surprising. They're feeling support. They're feeling like they can trust the system. And so they're turning to the healthcare professionals and their care coordinators for other items or for concerns.
Right.
And they're going to their prenatal visits. They're working, like, getting transportation to their appointments, or, whatever. They're using the resources that are available to them, and they're trusting the system, which is going to improve outcomes as well. So yes, you're going to see improved outcomes in terms of just you're eating a better, more balanced diet, you're reducing stress, but also, you know, maybe they'll be at their prenatal visits and preeclampsia will be caught earlier, or, you know, gestational diabetes, or, you know, whatever it may be. You will be more, you know, you'll be more engaged in your healthcare as well, and then that'll improve outcomes too.
It's almost like providing wraparound services for the mom and the family to ensure that this pregnancy is a healthy one, and we're able to help the mom and the baby.
Absolutely. And I want to make sure we have a few moments to open it up to questions from the audience. But I want to ask you, I would be remiss if I didn't ask this before we do so. You've already done, I mean, so much. So Illinois covers a year of postnatal coverage. We were the first state to do so under the Medicaid program. We have doula coverage. We have implicit bias training. We have extended the time for home visiting programs. You know, we just increased the vaccination reimbursement rate for children. You know, so you guys have already done just so much for moms and babies and kids in Illinois. But I know you're not done yet, because you are, you know, just such a visionary. And so I wanted to just sort of ask, what are some of your priorities for healthcare and improving maternal healthcare access, you know, that we can sort of anticipate in the next session or in years to come? Like, where are you setting your sights on next? Or if you don't know specific policy yet, like, what challenges are you trying to address? Sort of, what's your next steps?
Well, I think that the next step should be in, again, ensuring that the work that we've already done is implemented and put in place and supported by the various departments that are supposed to lead that charge. And so once we get that together, I think we'll be able to continue to move forward. Area that I want to focus a little bit more on deals with our elderly care, senior care, and how we care for our elderly. It's a very important topic, and I think we need to be understanding that a little bit more. Those have been some disparities that have shown up as well during COVID, and how the support that we receive for our seniors, as well as the caregivers for our seniors. So that's another area that I would like to focus on too.
And that falls onto mom's shoulders as well. I mean, especially sort of that sandwich generation of caring for children and then caring for aging parents. And the pandemic, I mean, it already existed, but the pandemic really, you know, put a spotlight on the gaps and disparity of long-term care depending on your race.
Yes.
And you'll see, I mean, if you look at the data where there are nursing homes, same owners in white communities having much higher outcomes with regards to infection control than nursing homes, same owner in communities of color. And I think I'm so glad that you are gonna, you know, sort of take up that conversation and figure out, I mean, it's just unacceptable. It's the same owners. So you've obviously figured out how to prevent infections you know, within that system. So why aren't you doing that? You know, what's working in a white community, why aren't you doing that in predominantly Black communities as well? Because you should be.
So yeah, it's like we're looking at the beginning of life and toward our end of life, and making sure that we have the resources and support for both. So.
Oh, I'm so glad you're taking that on. And Elena, I want to make sure we've got about 9 minutes left. I want to make sure that we sort of, if you've gotten any questions from the audience, that we have some time to ask them of Leader Greenwood. If not, I have like 8 more that can take up these 9 minutes, no problem.
Oh, and honestly, I could have just listened to you both all day. You are clearly going to be the best part of my day today. This was absolutely fantastic. So first of all, so much thanks from myself as well as to all the attendees for taking this important hour to talk to us today. And, I think that there were so many fantastic points that there's really, I don't know what to hone in on. But one of the things that I absolutely loved and one of the conversations I adored was when we were talking about strengthening the healthcare safety net ultimately strengthens the entire healthcare ecosystem. And I'm paraphrasing because there's so much to dive into in that part. But as Samantha had noted, based on the Commonwealth Fund in 2018, I want to say the US ranked last among developed countries for maternal health. And we know that maternal health and birth outcomes really are those leading indicators of health. And so to put in place all of these amazing initiatives, I think really lays the foundation for creating and making Illinois a best practice state. And I think that seeing this through and seeing those implementations really, I do think ultimately will lift up the entire state of Illinois. So thank you, Samantha, and thank you, Leader, for that work. We did receive some wonderful questions. I don't think we'll be able to get to all of them, but one of the things that you both were talking about, and I loved this question, is in what ways do we, and that means collectively as communities, as well as providers, as well as the whole industry, address community stigma as healthcare providers and care managers? Like, what do we do with that? And then how do we remove the burden off of the women's space? Saying women, oh, you're complaining too much. How do we invest in different language to communicate that? So I'm paraphrasing a few different questions, and there's a lot to untangle there. So I'm going to step back so you can answer.
Let me, because I'm starting, wait a minute. And we started our Medicaid work group shortly, but so I was kicked out. But so again, we have to continue to push out those resources and information to the communities, making sure that we open up access and opportunity, talking to the departments, the Department of Public Health, the Department of Human Services, Family Services, making sure that in doing that access and outreach to the communities, that we understand the needs of each community that we're dealing with. And so that sometimes includes language barriers. So we need to figure out, how do we address those barriers, and how do we get communication out to those members of communities like that?
And I could not agree more, Leader Greenwood. And I think to add on to that, we have a plan. Blue Cross is doing some amazing work where they're doing maternal support groups. And so they started virtual. They used to be in person, and now they're virtual, obviously, where they're bringing moms together to talk about the resources, so the moms can talk about their experience, and they can get that support from one another, from healthcare professionals, from advocates, and get that education and just be able to start to remove the stigma, and to become aware. Because I think often, as Leader Greenwood talked about, women are experiencing this, and they just don't want to complain. And so making sure they know, no, like, this is how healthcare and the care should happen. This is what should be going on. And if that's not what you're experiencing, or if that symptom is like far more extreme than what other people are experiencing, like, them being aware of that, and then aware of resources available to them, like doula coverage, like home visiting, like sweet potato patch, and healthy meals or support groups. I think that's how you start taking down some of these barriers, sort of brick by brick.
I think that's a great point. And actually, a few of the questions we received talked about isolation. This is a period where you're in transition and you have this feeling that, oh, I should be excited, or I should be feeling a certain way. And you also have to recognize that this can be an isolating time. And if this is your first baby, I haven't been blessed to have that experience yet, but you can know that there's a lot of changes that are going on. If it's your first baby, you don't know what to expect. So if you have that community and those support groups, like Samantha had mentioned with Blue Cross Blue Shield, that's a wonderful way to create that community. And dives into the next question, though: how can family members be good support teams and also advocates during this time of transition for moms and babies?
Well, for me, I'm blessed to have such a strong support system. I have one son, Nicholas. He's 18 now. But without my family and that support system, I don't know how I would have made it through, actually. And that's from the beginning of my pregnancy all the way to where we are now. But I think that the family support is important, and then also recognizing that some mothers don't have any support. And how do we get their needs met as well? It goes back to your previous question too about those support circles, what BJC or Blue Cross Blue Shield is doing to kind of fill in that gap in addressing that issue. But I think family support is always important in supporting the mom and the baby.
I could not agree more, Leader Greenwood. And to your question, Elena, I think it's important to recognize we talk a lot about postpartum depression and postpartum anxiety. But what we don't talk enough about is that there's very much prenatal anxiety and prenatal depression. And your hormones and just so much is going on in your body. And it is such a complex time that know that prenatal anxiety and prenatal depression are real and they're common. And so if you're feeling not as you anticipated, talk to your doctor, talk to your family, get support. And what a lot of women don't realize is that OBGYN, so your doctor that you see, in the prenatal period, it feels like all the time. But once a year, they are really well equipped to help you talk about like mental health and anxiety and depression, because they see it so much in the prenatal and the postnatal period. So, just highlighting that that's a resource. Families, talking openly about the struggles or the experience that you had. That postpartum depression and anxiety or prenatal depression and anxiety are very common, and just opening up about it and removing stigma. And I think is critical to make moms realize they aren't alone. And that there have been others who have sort of traveled these paths and they found support, and that they are, that there are resources there for them. Also, if you're on Medicaid and you don't want to talk to your doctor, please know that you can call your Medicaid health plan through your member services line, ask for a care coordinator, and that care coordination team will help you get the resources that you need. So you're not alone with or without a strong family support system like Leader Greenwood's.
And knowing that we have legislation to address those issues. So again, it's going back to pushing our departments to implement what we've already passed and what is already law, and making sure that the constituents of Illinois know what is available to them and the resource.
Yes. Absolutely. Well, and Leader Greenwood, go right ahead, Elena.
I just was going to say, it really does take a village, and I'm so grateful that we have individuals like yourself here supporting that policy and supporting that work so that we can ultimately wrap our arms around moms, babies, and families and support the healthcare ecosystem. We did receive a variety of other questions. Two things I'd just like to note. Thank you to your questions about maternal health and oral health. We do actually have a podcast. Check out our podcast on our website at Podbean, as well as IAMHP.net. To learn more about that. We also received some wonderful questions about the sweet potato patch and some of the different initiatives that are taking place. We've also done some webinars talking about maternal health and those pilots, as well as some of those projects. So if you're interested in learning more, check out our video library to learn more. With that, thank you to all of our attendees. There is so much going on. I'm going to hand it over to Samantha to close us out, though, but I'm really appreciative for the time you took out today for both of you.
Thank you. I just want to thank Leader Greenwood. She's so busy. She's such a strong leader. We are so lucky to have her in the healthcare space, to have her in the Illinois General Assembly and the leadership team. We're so grateful for her and for your time. So, Leader, I just want to make sure we are beyond appreciative and impressed by all of what you sort of laid out this hour, but really over the past years of the work you've been able to do for moms within your district, but really across the state. So just thank you.
Thank you. Thank you all for having me, and I look forward to talking to you again soon about these issues and other issues in healthcare.
Thank you so much. And to all of our attendees, thank you for joining us and spending an hour learning about this important topic. We will be sending out a recording along with some of those other resources that we already have to answer some of those critical questions of yours. Thank you as always, and be well.